There is like, how do you measure the treatment? There is like, what is the measurable outcome of your device? How do you like a little better? It's not a number. How can you measure? Because even in Jeff's case, one day he's a little better, another day. So how do we know that some measurable outcome? Anything you can?
Yes. This is such an important question. And in terms of, I'm so glad you asked this, because this is a classic problem in rehab, right? This is just, being a rehab specialist, so I'm also a neuroscientist, probably first and foremost. When you think about how do we know something's working, that is incredibly important to understand, because in both ways, right? We want to know whether or not we should continue on a path because it is having some improvement, or it's not working, in which case we either need to stop doing it or we need to change something. So to that end, this is one of the benefits of having a robotic system involved, because the robotic system can measure movement. It can measure what are called kinematics, which are basically ranges of motion, sort of the magnitude of movements, the rate change of those movements, sort of precision of movements. Those things are all really important. And when you think about ataxias are literally called, they're discoordination among limb segments. And so we can actually measure that at the hand and the wrist joints, and we can measure the precision of movements. So that's one set of things. We can quantify and measure kinematics and how those things improve over time. The other side of that coin is we can measure forces. So we can measure the strength about those individual segments because we have sensors on there. So we can digitize and quantify all of those various measures of movement, things like how much we can move and how strong we are. So those provide a detailed sort of picture of exactly how our state is from start, and then as we progress. And this is the wonderful thing about having robotics. And I think this is a classic problem in medicine, and it's even more problematic in rehabilitation, where, and you guys have probably experienced this too, when you go to a physical or occupational therapist, they may do an outcome measure on day one. And then you go through 6 weeks of rehab, and then they do an outcome measure day 6 weeks or whatever, right? But it's really hard to know, like, well, that's a big gap between those 2 points. It would be nice to know, hey, day 2, we're getting some progress, or day 3, we're getting progress, hey, or we need to change something about this. And so the classic problem is the intervention is interposed between our assessments, which means they are uncoupled. That is a classic problem. And unless you put a robotic system or a series of sensors, which the robotic system has, unless you put sensors on board, you will always have those things uncoupled. And so what's nice is this system actually couples them together. And so every time that we do a movement for therapeutic purposes, we're quantifying it. So it becomes an outcome measure every single time we're using it. And so there's no longer this discontinuity between when we're doing an outcome measure and when we're doing intervention. They are now one and the same. So we will know when things are improving or when they're not improving.
So what is a trial like? When do you know that the device fails or Jeff fails? The bottom line, when it's a week, you know that this is not the right device, or how long you and who make this determination?
Sure. That determination is always made by you guys. Motus Nova will not pull a device back because we say it's not working for you. What we will do is we will work with you to make objective data available, and you guys can make an informed decision. And that's why I said it's so important to start from the goals, because if you work from the goals, then you will know whether or not it's working or not. And that's why if you're talking about trying to attenuate losses, right? If we're on kind of a path that's down, in terms of a loss of muscle strength and loss of range of motion and these sort of things, if we're on a path down and our goal is to levelize that path or normalize that path to make it be more stable and to have a prevention of attenuation, then we'll be able to know whether or not we're hitting that goal or not. If the goal is to have improvements in those things, then that's a different story entirely. And so that's why I always like to start off with, what's the goal? Is the goal realistic? And then we'll know objectively, right? We start from where we want to be, and then we can start to design exactly and ask those questions, or, hey, are we hitting this goal, or is this goal reasonable? And then you guys will be able to know, hey, I'm hitting this goal or not hitting this goal. And
what
generally,
about, Sorry. What about the data that you said, robotic data? Are you sharing with us like this?
Yes, all of it's available. Yep. Okay. Every bit of that is available on console. And in terms of post each exercise, it's all presented to you guys. And so you will know the ranges of motion, the time spent, the forces, the precision, all of that stuff. That's all present. And so when it comes to, we try not to present everything simply because it's pretty much a data, it can be a bit overwhelming, kind of drinking from a fire hose, if you will. Because those sensors are capturing about 20 points a second, 20 to 50 points a second, what we do is we generally present summary statistics over the course of maybe sort of 1 second epochs over the course of a given day. And then those data are available to you guys to understand how things are going. And let me just go back quickly to your question and answer it in a very, very directed way. And that is, when do we know something's going to happen? And I think the data helps sort of clarify that, but because you can look at trends. But that being said, it's very, very hard for me to pull out my crystal ball and say, Jeff is going to see something at this point, or we're not going to see it at all. That is probably impossible for anyone to do, regardless of the amount of data they have. And B, it would be unethical because there's so many unmeasured variables that matter. That anyone who's going to tell you that this is definitely going to work under these circumstances is just probably lying to you. And so I think the best thing to do is to rely on what the scientific data says. And that data, those trials ran for around 3 months. In those trial periods, we saw what are called clinically meaningful improvements, or they reached what are called the MCIDs, or minimally clinically important differences. And so generally speaking, if we hit the kind of that 3-month period and we're still not seeing, meaningful improvements, it might be at that time to really question if this is a viable option for Jeff. And of course, some people can take longer than that. Some people can go quicker than that. But it's very much dependent on a combination of what are the goals, and then also just acknowledging that Jeff's condition is a little bit different than sort of the classic stroke survivor per se.
So basically, you don't have a patient with brain tumor who employ those devices, or do you?
So I think we have a number of individuals who are post-surgical resection. I don't think I have to go through and look, but I don't know specifically if there's someone right now with Jeff's specific condition right now.
Okay. Can you address the biofeedback aspect of this, which is something that was very interesting to me?
Yeah. Yes. So the biofeedback. So there are a couple of things that are really important for neuro-rehab. You guys, if you've already talked to us, you already know kind of one of those, and that is the importance of repetitions, right? Dose, super important, right? Like any other medication, the dosing is really, really important. How much active ingredient are you getting to actually induce a positive change? But the other thing that's really, really important, it's in dose as well. And that's not only the sort of amount of the therapy you're getting, but it's the quality of that therapy. And I'm getting to your point here in just a second, Bryce, but I'm going to wrap around with our three-prong approach here. It's the quality that's really, really important. And that is, are we actively engaged in rehab? Because when you think about principles of neuro-rehab and principles of motor learning, in order for us to actually redevelop a circuit that can purposely control a limb again, you have to be able to actively engage the circuit in order to effectively try random configurations of neurons out to see which ones work and which ones don't. Absent active engagement of that, it won't work, period. What I mean by this is I can come over to you, Bryce, right now, and I can move your hand 1,000,000 times in the course of a month or two, and it would cause no changes in your brain, right? But if you induced 1,000,000 movements in your brain with your hand, say, for instance, if you were trying to play the violin or play the piano, that would cause a positive change, right? The kinematics could be exactly the same, but the fact is that your brain was engaged in one of them and not in the other. That is a fundamental element and fundamental importance. The other very, very important thing that kind of goes in between the two of those critical factors is the importance of biofeedback. It's when I'm playing the piano, did I hit that note right? Or if I'm throwing a baseball, did I throw the baseball correctly? Or did it go off crazy to the right-hand side? Okay. that biofeedback is absolutely critical as what's called a learning stimulus to know whether or not you did the thing that you executed was right. For instance, if you're learning to walk again, a very powerful learning stimulus that you did it correctly was, hey, I actually walked from point A to point B. A powerful learning stimulus for you to know that you did it wrong was, hey, I tripped and fell. Those learning stimuli are often very hard to get with following neurologic injury, whether it's post-traumatic brain injury or post-stroke, simply because a lot of those sensory systems can be misinterpreted. And so having visual biofeedback, having multimodal information, auditory, visual feedback, even kinematic feedback, can help augment those systems to help you learn better. So it's all designed to help you get what's called knowledge of results and knowledge of performance. Those two things are critical for us to learn. So that's really the importance of biofeedback. And the games provide a really convenient way to help people get that feedback. But it's not like you did it well or you did it poorly. It's you won the game. You got extra points, right? So it's ingrained inside of the game. So it's hidden behind the games.